Let's talk about sex, baby. Let's talk about you and me. Well, not me specifically and you together, but you and your partner, you and yourself. Let's talk about it because there's not a lot of information about it, and we are going to interview an expert today and answer all of your burning questions. Hi all you beautiful birthing people. So today I have literally such an exciting video for you guys. It's going to be all about postpartum sex, a topic that is very rarely covered except for the fact that everybody's like, oh, your 6-week appointment, you get to go have postpartum sex, how exciting. But there's so much more to it than that, and I feel like it's either not talked about or all you get is horror stories. So we are sitting down with an expert in pelvic floor health, a pelvic floor PT, Dr. Michelle Little, who owns Women in Motion Wellness. That's her handle on Instagram. I'll have all of her resources linked down below. You can even schedule a virtual consult with her. So anywhere you are, if you want to meet with her, it is an option. She is amazing and sweet, kind and supportive, but most importantly, is an expert in her field. She is certified out the wazoo, and I think you guys are gonna love her. Definitely check out her Instagram. And just for clarification, guys, when we talk about sex in this video, we are speaking of penetrative sex, which could be a penis in a vagina, a toy in a vagina, fingers in a vagina. So that's the kind of intercourse that we're speaking about specifically, while understanding that there are many ways to be intimate with your partner, and sex is just one portion of that relationship. We just wanted to kind of give that clarification. I'm going to be popping in here a few times via video, but mostly what you're going to see is a Zoom meeting. I want to apologize for a few things. One, the sound, particularly on my end, is a little rough. And then you also are going to notice that I left it on seeing both of us instead of switching back and forth, which is what I did when I talked with Krista Dancy, who was our trauma specialist, and I'll leave that linked as well. And unfortunately, what I've realized is that my intent listening face and comprehensive face is just really significant resting bitch face. So I want to apologize for both of those things. I just was listening and really paying attention, and I look very angry. So sorry for that. And I hope you guys enjoy the video. Okay, so something super, super exciting. Dr. Little and another partner of hers actually have a 6-week building block program that is a postpartum group for moms and babies that meets virtually and also gives you a support system. And they are going to be doing a giveaway for 2 free spots in this class. So I'm going to leave the giveaway information down below. It's all through Instagram. Based on what I've seen from the rest of her Instagram and just from talking to Michelle, I can guarantee you that this class is going to be top notch. And I think we do a lot of preparation for birth and a lot of preparation for labor. I think that's important. But I think that we don't do enough for postpartum. And so I think that this group, because it focuses both on the person who gave birth and then also the person that was given birth to, right, your baby, it's going to be really beneficial. So I want you guys to check out this giveaway. And even if you don't win the giveaway, consider taking the class. Thank you so much for being here with us today, Dr. Little, or can I just call you Michelle? Is that fun?
Absolutely.
Awesome. So we are just we had over like 150 questions submitted, which is crazy. So what I did was, obviously I'm not going to use anybody's usernames or screen names. We want to keep this anonymous, and we want to kind of make it general so that it can apply to just about everybody. So I think the number one question, well, there are 2 number one questions, but we're going to start off with the first one. And that is how long to wait before having intercourse postpartum. So do I need to wait 6 weeks even though there's no tear? What is the recommendation there?
Yeah, so generally the recommendation is 6 weeks. Obviously, that's something that you want to wait until you're cleared from your birth provider. You can have stimulation before the 6 weeks as long as that feels okay. Keep in mind, especially with clitoral stimulation, that if you're stimulating that area without any penetration, that causes more blood flow to go to the pelvic floor muscles, which might cause some pain or heaviness or pressure. So in general, we do say wait 6 weeks for that healing, regardless of the method of delivery.
Okay, awesome. And then this is kind of the second biggest question is, so postpartum sex, I feel like it's either not talked about at all you get is horror stories. So how can people who are having sex for the first time postpartum, or it hasn't been the best sex so far, how can we, 1, make it comfortable, 2, make it good sex? Is there lubrications that we might need to use? What do you recommend?
Absolutely. So I always recommend using digital penetration first just to get an idea of what's going on. Even if there wasn't like a grade of laceration or perineal tear, sometimes there's just like little micro tears or traumas along that vaginal wall. And so you can actually, I have my pelvic model with me, um,
Awesome.
but you can actually just insert your finger into the vaginal canal and kind of push down towards the anus, push to the right, push to the left, and just get an idea of what that area feels like, and if there's any kind of pain in the area. I always definitely recommend foreplay and using lubricant. So water-based lubricant is good because a lot of times what I hear is, like women can have penetration and that's okay, but then as it's going on, that's when it becomes painful. So just making sure that the whole area is lubricated. And then positions are really important. So having mom be on top can help control the depth of that penetration, which can significantly improve. And having that control can also just help with the fear and anxiety of having anything in the vaginal canal after having a baby. So those are kind of like some quick tips. I don't know if this is one of your questions you'll ask later, but I also recommend like perineal massage, just like we recommend it during pregnancy to help decrease the risk of perineal tears. That's also a great thing to do postpartum before having penetration, just to help kind of prep the tissue and prep that area.
Okay, awesome. Yeah, and I think one thing, so we talk about lubrication, we know that after you have a baby, particularly if you're breastfeeding, your estrogen is going to be super low, and that's your body's way of kind of protecting you from having more babies at this point. And so that's why the lubrication is so important. I guess another question, and this kind of goes off of those first two, is how do you know if it's something like going on with your hormones, like it is that low estrogen that we just talked about, versus like, is there something more significant going on that I should go seek out a pelvic floor PT for?
Yeah. So anytime that you are nursing or just in general postpartum, those estrogen levels are lower, and that can actually cause the vaginal tissue to atrophy a little bit, and that can contribute to the pain. So the difference is typically when the muscles are spastic, we have pain either at the entrance. So this muscle right here is bulbocavernosus. That can sometimes be a little irritated, especially if there's been any kind of perineal lacerations in this area. And so that would be pain right at the opening. Or like these deeper pelvic floor muscles can be painful with depth of penetration. That typically will feel, pain can be described in so many ways. So sharp, aching. I've also had women say they feel like a burning or stinging pain. Versus if it's more of the vaginal tissue, it kind of feels like friction and it doesn't get better. Like the more you do it, it's like more friction and irritation to that area. So it's like a dry, irritated area. And a lot of times you can't really isolate, like, is it one or is it the other? It might be a little bit of both, and that's why a pelvic exam is so appropriate. I really commonly and frequently communicate with the birth provider in terms of like what my findings are, and we can make that recommendation of like maybe mom will benefit from some topical estrogen for a little bit in combination with some pelvic floor PT.
I think you kind of touched on this, but one question we had is spotting normal after sex? And it sounds like that would be more of that estrogen issue with the atrophy of the skin versus like a muscular issue.
Correct.
Okay. Awesome. So it sounds like if you're having spotting after sex and that's the biggest concern, perhaps going to see your birth provider first, your OB or your midwife, and then maybe moving on to a pelvic floor PT might be ideal.
Absolutely.
Okay. So is it normal to have low sex drive or desire after having a baby?
Absolutely.
Yeah, 100%.
Lots of things that play a role in this. Libido definitely has a hormonal drive, but also like what's going on in your life. Like you just had a baby, your whole world has changed. Like, are you sleeping? Are you eating? Are you exercising? Like all these things play a role. And I am a big fan of pleasure mapping throughout different phases of our lives. So, things in areas of our body that maybe brought on stimulation or areas that we liked might not be an area that we like postpartum. And so I always encourage couples to do pleasure mapping. So, you set a time limit and you kind of explore different areas. You can explore different pressures, temperature, and see what is stimulating and kind of explore those areas a little bit more. But definitely like just the basic needs of sleep and food, and just feeling that support can make a huge difference in sex drive and libido.
Yeah. And I think kind of talking about the pleasure mapping, one thing that I think a lot of people, if they've had babies before, or if they're just kind of thinking about it, even in later in pregnancy, like nipples are not like a great area anymore. And then once your milk has come in and you're trying to be intimate with your partner, you might notice too that like you're leaking milk and like things are just really kind of out of control there. So keeping a bra on, I think, can be really beneficial, and with nursing pads in there, so that if you do end up leaking, it's not like something that ruins the whole moment and makes you feel really self-conscious about yourself. Because if you do leak during intercourse, it's actually super normal, because it's that oxytocin that makes our milk come in, and it also makes us have orgasms. So the back to that question, knowing if it's hormones or something physically wrong, we did have somebody say that her provider told her at 9 months postpartum that her painful sex was from underuse. Is that a thing?
No. So, like what does underuse mean? And I think sometimes as just clinicians or medical providers, like we might say something that we're trying to relate to the patient in a different way, and then it's just taken the wrong way. But no, there can be atrophy of the pelvic floor muscles, but I see women all the time with atrophy of pelvic floor muscles and they're still having intercourse and it's not painful. The spectrum's pretty large. Like you might not have as pleasurable intercourse. You might have lack of sensation. I also hear very often women that say that they don't have any orgasms. So it's not always pain driven. And I think if that provider meant, lack of use is like atrophy of the muscles or atrophy of the vaginal tissue, just knowing that might not always be pain. It could all just also be that you're not feeling orgasms as intensely or as frequently as you did before. And those are both situations where a pelvic PT can be very beneficial.
Awesome. Yeah, it almost sounded to me in the way that the provider said that they didn't know what the solution was, and they were almost kind of brushing the person off instead of referring them to a pelvic floor PT, which could be helpful. Because here in the United States, and I guess it's different in different pockets of the United States as well, but where we are not seeing a great number of referrals out to a pelvic floor PT. It's kind of something that you have to explore and figure out yourself. And when you have a brand new baby, that's just like one more thing on your list.
Absolutely. Yeah, in my private practice, 70% of my patients are direct access, which means they find me through word of mouth, or they find my Instagram account, and then we call their provider and get a script. So that's pretty wild. I mean, that's the majority of my patient caseload. So yeah, and I always tell women, like, if you feel like your needs aren't being addressed, or sometimes it's also just you forget, those appointments are short and you're like still in survival mode at that 6-week appointment. So that's not something that crosses your mind. So yeah, advocating for yourself and, just having the courage to speak up and say like, hey, I think I've heard about pelvic PT. That might be something that's beneficial for me.
Yeah, I also think it's tough if you're going in at your 6-week appointment and you haven't had sex yet, so you don't really know what it's going to be like. And then to schedule another appointment, my copay to go to the gynecologist is $55 every single time I go. So that's like just another thing that kind of adds on to it too. And then right now in the time of COVID-19, a lot of places are restricting if you can bring any other kids with you, or even bring your baby in with you to see the provider. So then you have to find childcare. Does your baby take a bottle? I could make a whole video on all that because I have a lot of feelings, but yeah, it's just a lot. And so I love that there is the option to kind of bypass your OB if you feel like you need a pelvic floor PT and go back and get the prescription from them, and that you don't have to get the referral directly out. Do you know if that's that way across the whole United States, or?
Yeah, that's a great question. So, in most states, there's some form of direct access. It's limited and it depends what state you live in. So, for example, in Virginia, we have 30 days of direct access, and that's 30 calendar days, not 30 visits. And I do all the work for our patients. So, we call their provider and get a script. A lot of times, if it's been a while, like maybe it's been 6 or 9 months, we can even get it from your PCP. Essentially, whoever has seen you recently is who we contact.
Awesome. Okay, let's get back to our list. We got a little off topic, as tends to happen. We've already kind of spoken about this, but somebody did ask, how long will it take for the scar to soften if you have a perineal tear and to not feel so sore? So we talked about how doing a little bit of massage can help. Do you have a video on doing perineal massage on your Instagram?
I do, and
Okay.
yeah, I can like link it or make
Yeah.
you.
Yeah, I'll link to that because I think that could be really helpful. But what is our time frame that we're looking at for that scar to heal?
So scar healing, we typically expect that to be healed by 6 weeks.
Okay.
In terms of, that's not every situation. Some signs that it might not be healing is like foul smell, severe pain, any kind of like oozing at the incision or more bleeding. And that's definitely something where you want to call your birth provider and have them take a look at it. There's so much that they can do during those early 6 weeks to kind of help with the pain management side of things. In terms of, scar tissue specifically, it really depends. We all scar a little bit differently. For some women, like I honestly see them once or twice. We do an assessment, cover specific areas for them, and then incorporate that into a program, and they do totally fine. And then I have patients that take a little bit longer because that scar tissue and that pain has then evolved into other things, which is a little bigger. So that's why I always say, like, if you're having pain with intercourse, it's always better to just get it assessed and go ahead and have a program that you're working towards. Because a lot of times, if we're perceiving that intercourse is painful, then we become anxious and fearful of it. And that can also just cause those muscles to tense up. Just kind of like if you're scared of something, kind of like tense up our neck a little bit. Well, the pelvic floor muscle, they do the same thing. So
That makes a lot of sense. So we've talked a lot about vaginal births, about vaginal tearing, but I had quite a lot of people say, well, I had either an unplanned C-section where I labored first, or I had a planned cesarean birth. And with both of those, I'm still feeling discomfort with intercourse postpartum. Is there a reasoning behind that? They're a little bit confused, I guess, because the baby did not come through the birth canal.
yeah, and I'm not really sure where this idea came from that if you have an abdominal birth, that your pelvic floor is spared. Because remember, like those moms carry this baby for a long time as well. And so I just want to show you on the model. The pelvic floor muscles run from the pubic symphysis, which is this bone right here, all the way to our tailbone, and they work like slings. So during pregnancy, as the baby's growing, essentially it's like a little kettlebell that we have growing. So if, like, let's say maybe mom already had like some muscle imbalances in her body, and then you have this like increased weight and all these hormonal changes and laxity changes that are going on, our body's reaction sometimes is to cause the muscles to kind of tighten for stability. And so those kind of overactive or tight muscles can be some of what causes pain with intercourse. So it might be completely unrelated to the way that you delivered, and more just the fact of like being pregnant and all those changes that occurred. And so there's then also this idea that magically gets better postpartum. But we know that any kind of persistent pain of more than 3 months can then mask into other things. And so again, definitely something to get addressed. In most other countries, women have a pelvic PT evaluation automatically after giving birth, just because there's so many changes that occur in our body. So I'm a big advocate. I feel like every mom after giving birth should see a pelvic PT at least once, just for some overall bowel, bladder, sexual function, and some fundamental return to exercises.
Yeah, I agree with that. Somebody was telling me in France, they get like 10 visits or
Yeah,
something crazy.
automatically. Yeah.
Automatically everybody. So let's work on that, America.
Yeah.
Thanks. Yeah, and I wonder too, this is just me musing, but if we have an abdominal birth, a cesarean birth where we are cutting those abdominal muscles, do people tend to overcompensate with their pelvic floor and those muscles get tighter because they're not able to use their abdominal muscles immediately
Yeah,
postpartum?
absolutely. So, I mean, that's like 7 layers to get to baby. And then it's a major abdominal surgery. So, you have inhibition, swelling, which causes those muscles to atrophy. Right. And if you think of where the abdominal muscles attach, it's right along the pubic bone. So, if you don't have this abdominal support, it's going to put a lot more stress on our back stabilizers and our pelvic floor muscles. So, absolutely. I mean, it's a whole kinetic chain, which is why people say like see a pelvic PT, but a pelvic PT is a physical therapist. We're musculoskeletal experts. That's what we have our doctorate in. So it's really looking at the whole system, not just your pelvic floor.
Awesome. That makes a lot of sense. And something to keep in mind too, just from like obstetrical side of things, if you've had a cesarean birth where you labored, particularly, you were still getting vaginal exams, the baby was still getting lower, especially if you pushed and then you had your cesarean birth, all of those muscles and even sometimes like your vaginal tissue can be affected by that. There could be like increased swelling, micro tears, even just from the vaginal exams and from pushing. So just something to keep in mind on the other end of that, where there still could be some trauma just from the birth, even though the baby did not exit through the vaginal canal. So the next question is kind of a more specific one, but I had one person ask me, what do I do if I have gone to the pelvic floor PT and it's been upwards of a year and I had a more significant tear, a 3rd or 4th degree tear, and things still aren't getting better? What would you recommend somebody do if they see the pelvic floor PT, they've been seeing their birth provider and things aren't getting better?
Absolutely. So a couple of things with grade 3 tears, right? So
Grade 3 or grade 4 is what the person said.
So a grade 3 tear will go right to the anus. A grade 4 tear goes through the anus. So some things that we're always concerned about there is how is that anal sphincter? Is that intact? Anytime I see a grade 3 or grade 4 tear, I usually give them about 3 or 4 visits. And if we're not seeing improvements, especially in bowel function, oftentimes I'm the one referring those patients out to urogyne or a colorectal specialist. We want to make sure that sphincter is intact. That is involuntary muscle. So there's a lot that I can do, but then there's also stuff structurally that I can't fix. And so some concerns with that are, if you're having any kind of fecal incontinence, which is loss of stool, and a lot of times, we think of like pooping our pants, but also it's like if it takes a lot to wipe, like you're having to use a lot of tissue paper to feel clean, or you're seeing like on your underwear, like little streaks of fecal matter. Those are all signs of fecal incontinence. Or anal incontinence is the inability to hold in your gas. So I always tell people, like, if you're in an elevator, you had to pass gas, could you hold it in? And so those are things that we want to make sure. Secondly, I think, I typically tell all of my patients we should be seeing some pretty major changes within that 6-week period. So it doesn't mean you're 100% better, but you should be some percentage of better, understanding where you are on your plan of care and kind of what goals we're working towards. So I think a lot of times patients go into like a passive mode where they just like show up for their session. They're not really sure what they're working on anymore. And so that's a good time to kind of, check in with your physical therapist and be like, I've been coming for some visits. What's your home program? Does that need to be updated? What are things that you still want to address that maybe that therapist isn't aware of or has kind of been shadowed by other things? So just checking in is really important. I do that with my patients every single visit. My conversation always starts with how are you doing and what do you want to work on? We have things that we want to get addressed, but at the end of the day, like what the patient needs and wants are more important. So and lastly, always getting a second opinion. If you feel like you're not being heard or your goals aren't being addressed, it might not be that pelvic PT isn't helpful. It might just be that maybe that therapist has some limitations in her training and isn't able to serve your needs. And so, don't ever hesitate with any kind of medical provider or medical service to get a second opinion.
Agreed. That was going to be my thing. I was like, maybe see if somebody else has something else they can help you with. But your answer was a lot more well said than what I was thinking. So Another question that came up quite a lot was, are things going to be too tight for my partner, or am I going to feel much looser for my partner? How will things kind of come back together after we've had a baby?
Yeah. So ideally they come back and everything feels great.
Yeah.
Um, to be honest, I think as women we put so much focus on like what our partners feel or what our partners think. And I don't think they notice. So I always tell my patients, like, focus on what you're feeling. The goal is for sex to feel good. And, what does sex mean to you? Why are you having sex? Is it that kind of connection for your relationship? Is it for pleasure? Is it to de-stress? And making sure that those goals are being addressed. I hear it a lot with women that have prolapse. They're so worried that their partner is going to feel that bulge. They don't. So if you have pain or discomfort or you're not having pleasure, then that's a great time to see a pelvic PT. Chances are your partner is unaware of anything going on down there.
You mentioned prolapse, and I know this is like a whole big thing. Could you give us like a very brief overview, as brief as you can, which I know is hard, of what a prolapse is and what you might feel if you have a prolapse? Because do you ever have people come in who are having issues and they have a prolapse that they don't even realize that's what it is?
Absolutely. So pelvic organ prolapse is the descent of one or more of our pelvic organs. So in women, that can include the bladder, the uterus, or the rectum. And so the best way I have to describe it is like we have ligamentous support that helps hold those organs, and then we have the pelvic floor muscles that kind of also help stabilize. And so some disconnect in that musculoskeletal system can cause that organ to kind of descend down a little bit. Typically, it presents with heaviness, pressure, and then some form of bladder or bowel dysfunction. And it is extremely common, but it's not always symptomatic. So a lot of times patients kind of fixate on what grade of prolapse they have or like the exact diagnosis. And what the research really shows is that symptoms is the number one reason why people would have a surgical consult and pursue surgery. And so that's what we should be addressing. And we know that pelvic PT can help improve symptoms up to 50%. So that can be extremely significant for most patients.
Yeah, that's awesome. Okay, so if somebody is going to try and find a pelvic floor PT, find somebody to help them with painful intercourse, what are some certifications or ways that they can look to make sure that they're finding somebody who actually knows a lot about the pelvic floor?
Yeah, so there is a board specialization, WCS, that is through the American Physical Therapy Association and essentially the gold standard. Unfortunately, I think there's less than 300 in the whole country that have a WCS, just because it takes so much to have a board specialization. So some other certifications you want to look for are the CAP Pelvic, which is also certification through the Academy of Pelvic Health. And then just communicating, I always offer like a free 15-minute consultation with any potential patients to see what their needs are. So communicating with that therapist and discussing what issues you're having and seeing if they're qualified to treat that. So the way that the courses go, typically the first thing you learn is how to manage stress incontinence, and then you progress all the way into bowel pelvic health. And so also considering if you're an athlete and what kind of orthopedic background that individual has, or if you would fall maybe more under a neurological diagnosis, or even peds. So pediatric pelvic health is also huge. So those are all things that you want to consider, and really communicating with that therapist on what your needs are and what courses they've taken to meet your needs is very important.
That makes sense. So if somebody is in an area, you said there's only like 300 in the country, and they are in like a dry area where there's like a pelvic health PT desert, they can meet with you virtually, right? Okay.
Yeah. So you can always go to the apta.org. They have a Find a PT button, and so you can look for, it'll show you with a red banner anyone who's board specialized, and then you can read bios to look at their specific certifications. But virtual consults are also available. And then the other thing is there's also a CAP obstetrics certification. So I have both obstetrics and pelvic health. But that's another thing, like if your symptoms are maybe more like pubic symphysis pain or SI pain, and there might be a pelvic health component, is trying to find someone that has that obstetrics training and the pelvic health, because there are some pelvic health PTs that never see pregnant or postpartum women. They will focus on postmenopause or pediatrics or neuro. So yeah, it's not just finding a pelvic PT, but finding a pelvic PT for your needs.
That makes sense. Awesome. Well, I will leave your website linked below if people want to do a virtual visit with you too. So let's see. I think we are on to our last question. Let me just read through and make sure. Yeah. So if we have somebody who's watching this video and they are thinking, okay, like I really need to go see a pelvic floor PT, or if their OB refers them to a pelvic floor PT for painful intercourse, what they would expect to happen in their first visit, their first couple of visits coming to see you?
Yeah, I love that question. So again, we're musculoskeletal experts. So a typical examination should include like a postural assessment and some feedback on that. I always look at lumbar mobility, so seeing if there's any kind of, low back pain, hip pain. And then with the pelvic exam, I always start by actually doing an abdominal exam. So checking if there's any kind of diastasis recti, thinning of the linea alba. Pressure management is super important. And then always doing an external exam first. And so we can get a lot of information by palpating these muscles externally, looking at how you're relaxing and engaging, checking reflexes, checking sensation. And then there's also the option to do an internal exam where we actually look at those pelvic floor muscles and how they coordinate with the rest of your system. So what the endurance of them is like, their ability to quickly contract and relax. And that's a big deal because a lot of women are told, oh, just do Kegels or Kegels, like that's fine. But it's like, it might be that when you cough or sneeze, those fibers aren't contracting quick enough to close your sphincter. And that's your issue versus that your pelvic floor muscles are just weak. Or maybe coughing and sneezing isn't an issue, but when you run 5 miles, you leak because you're having more of an endurance issue. Or posture can also play a big role. Like after having babies, we have this bump, so our pelvis tends to tilt forward, which is automatically loading those anterior fibers a little bit more, which is where our bladder is, right? So we're kind of tensing more on that weakened system. So just understanding exactly what's going on and having a program specific for each individual is so important. And so that's the benefit of an internal exam, but it's 100% what you feel comfortable with, and there should be consent at every step of the way. And I always tell my patients, if they want to bring their partner to the appointment, if that makes them feel, safe, like we hold space for that, and that's absolutely fine.
I love that. I love the thing about consent too. I think that's so important. Anything else that you've thought of that might be useful to bring up? I know you have all those tools. Did you want to show
Oh, yeah.
what those were for?
Yeah, absolutely. Okay, so these are dilators, and the reason why I brought these out is because very often OBs will prescribe these to patients and then forget to tell them how to use them. And so I find the dilators can be really helpful if you have a significant tear that's really painful, or you have fear of having a penis or a toy in the vaginal canal. These are just tools that can be used. They come in different sizes. The idea is that you build up to the size of your partner or the toy that you want to use. And it can just help with a couple of things. So you can work on like movements, rotations, angles, in and out motions, and making sure that the pelvic floor muscles aren't kind of contracting and causing pain with that. And then there's also a pelvic wand, which I really love this after having a baby, because the way that this works is it has 2 angles. This is a thinner angle, and then this is a little bit of a thicker one. But essentially, you can use this to release some of the tension in the pelvic floor muscles, or even just create like a little bit of a stretch in different areas. And that can be really helpful to do before having a penis or a toy in there, just so that you feel more independent and in control of what's going on down there before we're bringing someone else into the picture. a lot of my patients to use for their home program. We don't use it in clinic unless I'm teaching them how to use it. But this is a great tool for home. And in fact, a lot of what I do with patients, like being a new mom, it can be so hard to just like get into pelvic PT consistently. And so, you know, I always like have like a pelvic floor model that we print out for them, and we work on like specific tissues. And so we name it by the clock. So pubic bone is 12, your anus is 6 o'clock. And so they're working on specific angles with the wand that are specific for them. I definitely don't recommend just like buying one of these and like sticking it in there.
Don't do that.
But yeah, having, you know, if you're seeing a pelvic PT and like there's financial limitations or time limitations, that's a great tool. You should have some form of home program where you're also working on things independently at home.
That makes a lot of sense. Yeah, it's kind of like going to the chiropractor. Like they're going to give you stretches and stuff to do at home. They're not going to get all the work done there. They'll do the adjustments, and then you kind of have to keep up with everything else.
Exactly.
That makes a lot of sense. Anything else that you want to add? You guys are doing a giveaway, right?
Yes, we are launching our Building Blocks postpartum class, and it's a 6-week class that I partnered with one of my best friends who's a pediatric specialist. So my portion is the women's health portion. So each week there's an educational module on core, pelvic floor, getting back to exercise, and then the last module is perimenopause and menopause, because I really believe in having that knowledge and understanding your whole women's health life. And then each week there's also a live workout where I give you feedback on form, positioning, and then we do like a Q&A after. So it's women from all across the country, so it's so much fun to just have that community group. And then Emily, who is the second half of Building Blocks, she covers tummy time, rolling, crawling, and pre-walking. So all the gross motor milestones and how to incorporate that into purposeful play. So our goal and kind of mission with Building Blocks is to really serve women through their whole first year of birth to the first year of baby being born.
That's awesome. And you guys are doing the class in November.
Yeah, November is our next class. So there's like an on-demand and a live portion, which is why we do it like seasonally. And then we're doing a giveaway. So we'll be giving away 2 free entries to Building Blocks, and I'll send you the link for that.
Okay, perfect. I think that would be perfect for all of my viewers. That's awesome. Thank you. Okay, so quick outro. I just want to thank Dr. Little so much for doing the Zoom with us. She's fabulous. Please check out the links down below if you are searching for a pelvic floor PT. If you want to check out Dr. Little's Instagram, also fabulous. And until next time, stay well, guys. And I hope you have some banging postpartum sex now. Bye.